Okay, good afternoon, everybody. Welcome to the City of Toronto COVID-19 media briefing for Thursday, April 23rd, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mr. Mayor?
Brad, thank you. And may I just start off by saying that while I addressed this earlier today at a modest memorial ceremony that we held here at City Hall in keeping with our current pandemic circumstances, I want to acknowledge today is the second anniversary of the Yonge Street van attack. And the passage of time does not diminish the horror of this event or dull the pain for the families of the victims and for the people who were injured and had life-altering injuries they experienced that day. And I just want to acknowledge that we committed ourselves that day to remember those who suffered as a result of that, to remember the heroism of those who helped, and to send our hearts out, our heartfelt remembrances to all of those families and all of those people on what is a very dark anniversary of a very dark day for our city. Today marks 1 month since March 23rd, the date on which I declared a state of emergency in the City of Toronto. And that declaration came at a critical time. There were at the time only 304 cases of COVID-19, and almost all of those cases were still traceable to travel or to a close contact with someone who had the virus. I looked, as I do on all public health matters, to Dr. de Villa's professional advice in declaring that emergency. Her advice then, which it remains now, was that we needed as many people as possible to stay home as much as possible, to get all people in the city to keep their distance from one another in order to protect the vulnerable and to keep from overwhelming our healthcare system. In order to protect the health of the city and save lives, we took action at that time, a month ago today. I declared a municipal emergency, the first time in the city's history, so as to allow us to respond quickly and decisively to the pandemic as the need required, and to make sure that we would always be able to make quick decisions needed during a crisis of this magnitude. While we know this health emergency continues, and it will continue for some time to come, we are making progress, and this week we had reason to have cautious optimism. We are slowing the spread of COVID-19, and thanks largely to the physical distancing efforts of Toronto residents, we are saving thousands of lives. But this month has not been without tragedy. COVID-19 is leaving a devastating trail in our community. 222 residents have died, leaving behind their loved ones and friends. We mourn with these grieving families, and we remain committed to preventing as much loss of life as possible during this global pandemic. During this emergency, Toronto residents and businesses have risen to the challenge and embraced Dr. de Villa's wise words: stay home, stay safe, and take care of each other. I want to thank the hundreds of thousands of Toronto residents who have done the right and the responsible thing and helped us in this ongoing war to flatten the curve and ultimately to defeat this virus. You, through your efforts, have saved lives. And by continuing to do the right thing and stay home as much as possible, you are continuing to save lives and to save others from becoming ill. I'm so proud of this city and how it has responded to this ongoing emergency. In the face of all of these challenges, so much good work at wartime speed has been done by Dr. de Villa's public health team, by the Emergency Operations Center led by Chief Pegg, and staff across each and every city division, including all of our first responders, and of course, most importantly, by many of you, the residents of the city, the businesses of the city, and members of the community. I've heard about so many acts of kindness, large and small, during this pandemic, and these acts do make a difference and are helping everyone to get through this. It's just the Toronto way. We're all in this together, and it's only in working together that we can actually beat COVID-19. Toronto Public Health has worked to respond to this pandemic by doing the important work on the ground that must be done, tracking the virus and trying to stop its spread. And I want to thank in particular the contact tracing team that has done the important detective work, tracking down those who've come into contact with this virus and making sure they're quarantining themselves. I saw them at work when I visited Toronto Public Health to say thank you just a few days ago. They are diligent investigators interviewing dozens of people to determine exactly who COVID positive people had come into contact with, so they knew where the virus might have spread. I supported Dr. de Villa's decisive action to issue a class order under the Health Protection and Promotion Act in order to emphasize the significance of self-isolation for those who are diagnosed with COVID-19, those who are suspected of having COVID-19, and those who are close contacts as identified and contacted by public health in respect of COVID-19. I think these actions, too, made a big difference to the progress that we have made. The city's Emergency Operations Centre has also played a crucial role. Led by Chief Pegg and by Deputy Fire Chief Jim Jessup, the centre has been at a Level 3 activation, the most serious level that we have, since March the 17th, 6 days prior to the emergency declaration. Since activating 150 people have staffed the EOC 24/7, representing 45 city divisions and partner agencies. It's quite a team of people who've worked hard and worked well. They've worked to solve every problem that has come up during the pandemic, whether it related to PPE, the personal protective equipment that protects people, shelters, the economy, or our partnerships with dozens of community agencies. The Emergency Operations Centre remains the lead on the city's emergency response to COVID-19 and any other potential emergencies. It has been closely monitoring, for example, the lake water levels this spring, and I'm grateful for their continued work, including on things that haven't yet and hopefully won't reach the stage of being an emergency. We've also worked to expand the city's emergency shelter system to protect residents we know are more vulnerable to COVID-19. In late March, Toronto Employment and Social Services found a way to offer in-person pickup of Ontario Works checks. They set up 3 specialized locations that allowed physical distancing and provided COVID-19 screening and education to the 80,000 people that rely on in-person check pickup. This doesn't sound like a lot, but it's an important thing both in the context of getting the help to the people who need help, but also making sure it's done safely and doesn't contribute to the spread of this virus. Food security has been another big issue and continues to be a big issue, exacerbated by the pandemic, and an early priority for the city was to create and implement a food access strategy. The strategy, developed with the help of large community groups, identified ways to prevent food banks from being closed and support those that continue to operate. We have worked to put food on the table of thousands of households across the city. Examples include, since the emergency declaration, the city's Social Development, Finance and Administration Division has opened 11 library-based temporary food banks, an incredible accomplishment and staffed in part by Toronto Public Library staff volunteers. Through these food banks, more than 3,600 hampers have been created, serving approximately 5,700 people in more than 2,260 households. We've partnered with the Red Cross to provide food hamper delivery for seniors and others that are in self-isolation who do not have alternate access to food. So far, the Red Cross has delivered more than 750 two-week food hampers to seniors in need, with 900 residents registered in this program so far. Over the past 2 weeks, Red Cross has been noticing that as seniors register for hampers, many take more time to do so because they're lonely and distressed and want to talk to the staff. So, starting today, the Red Cross will be offering psychosocial support from their skilled safety and well-being team members for seniors who are in obvious distress. Another thing to be proud of in our city, in addition to the many mental health services being provided through the 211 call center. To help our essential and critical service workers continue to fight COVID-19, we've opened 6 emergency childcare locations for frontline healthcare workers and essential city employees. Nearly 300 children from around 200 families are receiving care through the 24/7 emergency childcare centres, and we are working to open more centres. We moved quickly to provide a 60-day property tax and other city payment grace period to help residents and businesses hurt by the pandemic. On the support for business side, the city tripled funding for the digital Main Street to help businesses develop or expand their online services so they could maintain or expand their sales base online during the times when many businesses are closed on the streets. And we launched the Mayor's Economic Support and Recovery Task Force to help all sectors of the city's economy as much as we can now and through the recovery. Extensive consultation has been done with many sectors, and specific measures are being undertaken in response to what we heard. Throughout this emergency, this is all what has been done since the time, more or less, of the declaration of the emergency itself. And throughout the period of the emergency, we've had to make many tough calls for the sake of everyone's health in the City of Toronto. None of these decisions were taken lightly, and I made them all based on the advice of our public health officials, led by Dr. de Villa. The city has cancelled all city events and permits for events up until the end of June, as well as our spring recreation programs, closed all community centres to the general public, closed all park amenities, and I put in place an emergency order to ensure physical distancing in city parks and public spaces. These were difficult things to do, but they have all made a contribution to getting the message across and to actually practicing the physical distancing that we've talked about. And the vast majority of encounters between city officials and the public have been educational and positive. People have thanked our frontline officers for protecting their health, and relatively few tickets have been required to be issued. While these measures are tough medicine, they are necessary medicine in order to prevent the spread of COVID-19 and to save lives. We've started to see the efforts pay off in the models that Dr. de Villa shared earlier this week. Now, while we still need to stay apart, I know residents are still united and committed to working together to protect our city. It's been incredible to witness how our great city has responded to COVID-19, how we have focused on what's important, and that in particular includes protecting and helping many of our most vulnerable people, but protecting the health of everyone. This has carried with it a heavy price tag. Not that finance is the most important thing, but we have to be mindful of that. Upwards of $1.5 billion during the 2020 pandemic and recovery period, stretching through, one hopes, not further than the end of the year. I do not believe this amount should be made up by significant tax increases or major service alterations or by running a deficit, which we are not normally permitted to do. Therefore, we will need the help of the other governments, and I am strongly supportive of a request for a $10 billion to $15 billion backstop for Canada's cities that was made public and been formally presented to the Government of Canada by the Federation of Canadian Municipalities. Toronto is Canada's largest city and the nation's economic engine. An investment made in this city now, including in transit operating funds, for example, will pay huge dividends to the federal and Ontario governments as we get people back to work in Toronto and refill the coffers of those two governments in the process. In business, I would have called this a no-brainer. City staff have been working tirelessly in response to this pandemic, as well as to maintain essential city services, and thousands of volunteers have come forward to help, and I thank them for volunteering as well. We're a mighty population and a mighty public service at Toronto City Hall and throughout the city, and we've been able to add additional muscle where it has been needed the most. Through a redeployment plan, hundreds of city staff have stepped away from their jobs to provide much-needed resources to critical city services such as shelters and long-term care residences, with more to come. So while the past few weeks have been difficult, I want you to know that I've got your back. The City Council has your back. It will be meeting at the end of the month. And the City Government itself, the whole of the City Government, has your back. We are all working for you, and we are hard at work on plans for the recovering and the restarting of the economy, just waiting for the day when the numbers say that we can begin to move on that. We're a month into this emergency, and while it is far from over, I think we have shown in that month that we can rise to the challenge, the greatest challenge that has been faced by this city in this generation. We're meeting that challenge, I believe. Now more than ever, it's important that we stay committed to following public health advice and recommendations and orders so that we can beat COVID-19, reopen Toronto, and make sure that our city comes back stronger than ever. And on that note, I will ask Dr. de Villa if she will offer her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. As you've just heard, 1 month ago today, Mayor Tory declared a state of emergency in our city. At that time, there were 304 cases of COVID-19 in Toronto, 14 people in hospital, and sadly, one of our residents had died from this virus. Today, the numbers are very different. Today, there are 4,347 cases of COVID-19 in Toronto, including 3,933 confirmed cases and 414 probable ones. There are 293 people in hospital, 106 of whom are in intensive care units, and tragically, 222 deaths. I know that you join me, as you have each and every day, in offering sincerest condolences to those who have lost loved ones and wishing those who are ill a speedy recovery. These numbers reflect our friends, our families, and our loved ones, and they would be much worse if we had not come together to protect each other's health. I distinctly remember the day that everything changed for all of us. The day that I knew I needed to ask each and every one of you to take extreme actions to protect our city's health. We can always look back at these milestones and know that certain memories will be forever etched in our memories. March 23, 2020 was a cloudy day and very stressful in ways that I could not have imagined, and I knew it would be very stressful for you too. It was the day that Chief Pegg and I advised Mayor Tory to take the unprecedented step of declaring a state of emergency. I remember looking at the evidence, our local situation, and what was happening in the rest of the world, and I knew we had to act immediately because it is my job to protect your health. I knew I needed to focus on my patient. As your medical officer of health for Toronto, my patient is our whole city, each and every one of you. I knew that to protect your health, we needed to implement drastic public health and physical distancing measures that effectively would shut down our city. I knew that these measures would change your lives, both immediately and in the longer term, because how we live, work, and play influences our health. I knew that these decisions would affect our local businesses, our economy, and our health. And I knew that these decisions would change how we interact with each other, and more importantly, how we support and care for our friends, our families, and our loved ones. But these actions were needed to save lives. They were needed to keep our hospitals from being overwhelmed. And they were needed to avoid the devastating circumstances we are seeing in other parts of the world, like Italy and New York City. Today, the number of our COVID-19 cases in Toronto is lower than originally expected. This is because you took our public health measures seriously, and these prevention measures are working. While this has been exceptionally challenging and an experience like no other in our history books, our battle against COVID-19 continues and is not over yet. As you've heard me say many times, our current COVID-19 response measures are based in part on the experiences of other jurisdictions. We have seen the positive impact of physical distancing measures in cities and countries all around the world. We know that, like any medicine, they must be applied in the right dose, at the right time, and that they take time to work. Looking back over the last month, we know our public health actions have prevented and continue to prevent further virus spread in our community. In public health, each and every decision that we make is informed by the best available science and evidence. It's hard to believe that this unprecedented global pandemic was caused by a new virus that was unknown to us just 4 months ago. The science continues to unfold, and we are adjusting our approach depending on these facts and our local circumstances. As we look back on the past month since Mayor Tory declared a state of emergency here in Toronto, together with my team at Toronto Public Health, we have taken many actions to protect your health. We have conducted approximately 4,000 case investigations and followed up with thousands more of their close contacts to help prevent further spread of COVID-19 in our community. We quickly launched a new technology solution to enhance our case and contact tracing work. We educated local businesses, including bars and restaurants, on public health and physical distancing measures, and continue to monitor their compliance with these recommendations. We issued a first-of-its-kind class order under the Health Protection and Promotion Act to support effective self-isolation for those diagnosed with COVID-19 and those at high risk of COVID-19 infections. We've responded to outbreaks in local hospitals, long-term care homes, shelters, and other congregate settings, and supported implementation of appropriate infection prevention and control measures. We partnered with the University of Toronto and other community organizations to bring on volunteers to support our low-risk case and contact tracing work. And we answered approximately 20,000 calls from residents seeking information about COVID-19. And importantly, we encouraged you, in the strongest possible terms, to stay home as much as possible and only go out for the most essential of needs, and to practice physical distancing. And I want to thank you sincerely for taking these recommendations seriously. Our local health emergency continues, and we need to stay focused to win this battle. In order to get to the point where we can get back to enjoying our city with our friends, our families, and our loved ones, we need to stay the course. So with that, I sincerely thank you for all that you are doing to protect the health of our city, and ask that you continue to stay home, stay safe, and take care of each other. I'll now turn it over to Chief Pegg.
Thank you, Dr. de Villa, and good afternoon. Work and proactive planning in Toronto began before the first reported case of COVID-19 had arrived in Canada. In January, we commenced coordination meetings across each of the city's divisions and agencies. We proactively assembled the COVID-19 Planning Task Force, and this team laid the foundation for the response that would follow. On March 11th, we activated our Emergency Operations Center at Level 1, and only one day later, escalated that activation to Level 2. On March 17, we transitioned to a full Level 3 activation of our EOC, where we continue. This is the longest continuous activation of the EOC in Toronto history. Today, we are operating the largest incident management system structure ever implemented in Toronto, with more than 40 separate sectors, functions, and task groups working every day. From the outset of the COVID-19 pandemic, personal protective equipment has been a key issue and a significant challenge. The global nature of COVID-19 has placed unprecedented demands on the global PPE supply chain, and our team has had to deal with a plethora of issues that include lack of availability, severe delivery delays, price gouging and scams, the introduction of fraudulent and poor quality PPE into the supply chain, and the ever-changing needs and demands on our front lines. But our team has and continues to overcome these challenges. Today, as a result of the tireless work of our PPE task force, we have been able to maintain a working inventory of PPE that continues to meet the needs of our workers. COVID-19 has been one of the most rapidly changing situations that I have ever seen, let alone managed. The situation evolves not only from day to day, but literally from hour to hour. This resulted in us building nimble and robust processes that enable timely and effective decision-making. Formal senior leadership team escalation processes have been implemented whereby our EOC can escalate critical decisions for immediate action. To date, 30 SLT escalations have been completed, with full accountability and authority tracking mechanisms embedded into the process. We have seen divisional partners step up to create solutions to emerging needs. Examples include having our technology services team enable remote working capacity for more than 6,000 staff in record time, creating leading-edge PPE management portals and dashboards, the TTC repurposing decommissioned buses to meet the emerging needs of paramedic services. The TTC again stepped up to provide dedicated transport for our shelter clients who have tested positive or who require travel to be tested for COVID-19, converting libraries into temporary food bank locations, and creating more than 1,300 emergency shelter spaces, to name but a few. I have also witnessed incredible examples of dedication by people who continue to go above and beyond in response to this pandemic, like people who canceled wedding dress fittings, rescheduled weddings, and the many who haven't been home with their families in weeks as they support our continued emergency operations. Hundreds of people who have stepped up to take on new roles and to be redeployed to meet the needs of our residents. Our healthcare, shelter, and long-term care staff who deliver extraordinary care in the face of often daunting pressure. Numerous first responders who have canceled pre-approved vacation plans so that they can report for duty each day when our city needs them the most. And many who are working extraordinary hours each week as we continue to manage COVID-19 in our city. The City of Toronto's response to COVID-19 has been and continues to be robust, responsive, and responsible. Our three top priorities are, first and foremost, to save lives, to prevent our healthcare systems from becoming overwhelmed, and doing all we can do to protect our social and financial systems. I am extremely proud and thankful for everyone who continues to give their all as we battle COVID-19. In closing, I would like to acknowledge that today also marks the 2-year anniversary of the Yonge Street tragedy. 2 years ago today, I witnessed the impact of extraordinary evil and experienced firsthand the devastation it caused. We lost precious lives in our city on that day, and many more were injured. On behalf of our entire team, I extend sincere condolences to all those impacted by those tragic events. We also witnessed incredible acts of bravery, caring, and kindness as our city responded. In the days following the attack, I witnessed the incredible strength that so clearly emerged in our city. Strength like that shown by the D'Amico family, who have turned tragedy into hope for many through the Turtle Project. As a city, we came together to mourn, to heal, and to recover. And together, we showed the world that we are Toronto strong. I'm proud of this city and of each and every person who steps up to help when we face challenges. COVID-19 is one of the largest challenges that we've ever faced, but we will get through this together. Of that I am fully confident, because we are Toronto strong. Thank you.
Thank you, Chief Pegg. Before we go to questions, just to let reporters know that we have on the line Marianne Bedard from Shelter Support and Housing, Paul Raftis from Senior Services and Long-Term Care, and the CEO of the TTC, Rick Leary. First question to Janice Golding from CTV News. Janice, go ahead.
Hi, it's Janice. Yes, Mayor, you put out a statement this afternoon saying that you are going to be appealing to the federal and provincial governments for more funding for the TTC because the TTC is having to make some very drastic measures, taking drastic steps to protect the service. Can you just discuss that right now, please?
Well, I have joined with my colleagues, the big city mayors from across Canada, and have had individual discussions on behalf of Toronto alone with senior ministers in the Government of Canada. And we have made overall, as big city mayors in Canada, an ask of $10 billion, probably heading towards 15, and that's in order to, the difference, by the way, is in order to take account of some of the special needs of cities like Toronto that have more responsibility for things like homelessness than do other cities across the country. And the ask for us includes public transit, operating money for public transit. Our need this year from the Government of Canada and the Government of Ontario is for operating funds to help us make up the difference that we've lost because of reduced TTC revenue and a variety of other things. And as I said earlier on, I believe that an investment in Canada's cities, including the biggest city, Toronto, for which I'm responsible, is the best investment the Government of Canada could ever make, because they will get back not just the satisfaction of seeing the economic engine restart in this city, but also the revenue that comes from that through income taxes, through sales taxes, through corporate taxes. And in business, I would have called that a no-brainer. You do it because you know you're going to get the money back, and besides the money, you're going to get a much faster, much better recovery that will benefit all of Canada. So that includes transit money to make up the shortfall we've seen because of COVID-19, and I'm going to be pushing very hard with my colleagues to take a government that has already been very responsive to the needs of Canadians, and hope that it does the same when it comes to our cities, including Toronto.
Okay, and a second question. There's a sixth person now, or a third person today, that has tested positive for COVID-19 at the Queensway Garage, and we're told that there could, in fact, be more because people have been tested and they're waiting on results and they're symptomatic. The union is saying that the TTC has been far too relaxed, that it called on mass testing at the garage last week and for every worker to self-isolate. They say that the TTC has not been taking care of its employees and not giving them safe working conditions. Can you respond to that, please?
Well, I'll start, and maybe Dr. de Villa will pick up. Every step of the way, every one of these incidents, every case, and then we regret them all, obviously. We want people to be healthy, especially the operators who've done such a great job for us during the pandemic. But the Toronto Office of Public Health and the Ministry of Labour have been involved in assessing what has gone on there and the different claims that have been made. And I think without exception, the TTC has done what was expected to be done and was advised by these other bodies. And maybe Mr. Leary will pick up on that, and then perhaps Dr. de Villa. But I think that, again, we've been responsible in the way that we've tried to handle this, consistent with the advice of the people who are there to advise on these kinds of things.
Okay, Rick, if you're on the line, if you would like to answer as well, please.
Sure, absolutely. Yes, at Queensway Garage, we've had 5 incidents of positive testing in our maintenance area. And last night, in consultation with Toronto Public Health, and following discussions that we've had with the senior levels of executives in the union, the decision was that we would take approximately 45 individuals and ask them to self-isolate at home through the end of this month, and working with Toronto Public Health, we'll monitor each one of those individuals and make a further assessment as we go along, and with the hope of having everybody back on May 1st.
There are actually 6 now. Another person.
I'm sorry, 6.
Yeah, there's 6, but also last week, and that you have not stepped forward. They said it should have been shut down and self-isolation measures should have been put in place on March 19th when the first case came forward. So they're saying it's been quite a while.
So if I can, perhaps I can answer that question. So Janice, what I can tell you is that we've worked in close partnership with our colleagues at the Toronto Transit Commission, and I know for a fact, based on the work that we've been doing with them, that they take the health and safety of their staff and certainly of the riders on the system as prime priority for them as they move forward. I think the other thing that's important to note is that when we look at risk factors here in our city with respect to COVID-19, we know that there is a significant amount of community spread, but that the number one risk factor turns out to be close contacts, particularly within the context of the household. So, you know, we do have COVID-19 spreading in our community, and we know that it's very important that as cases identify, that they isolate themselves well and that we follow very carefully with their close contacts, particularly those from the household. So I think these are the important elements as we seek to prevent further spread of COVID-19 in our city. But I can confirm that our colleagues at the Toronto Transit Commission have been working very well and in collaboration with us and been following the best available advice, and that the decisions that are taken as we address COVID-19 in our city are made with the best available evidence at the time.
But Rick Leary told CP24 this afternoon that 6 of the 27 cases that the TTC have are amongst these maintenance workers at the Queensway garage. So, as you mentioned, close contact, why was there not a decision made earlier to have people there self-isolate?
You know, Janice, I will just remind you that, you know, again, the decisions have been taken with the best available evidence, that we feel that you know, our colleagues at the TTC are working with the health and safety of their workers at top of mind, and that there is indeed community spread, including that which is happening amongst close contacts, but in particular, it's household contacts that we know are very high risk.
Okay, thank you. Just a reminder, we do ask for a limit of 2 questions as there are a number of reporters on the line. Thanks for your cooperation on that. We'll now go to Albert De La Talla from Global News. Albert?
Hi, this is for Mayor Tory. What are the plans or interim plans for dine-in restaurants when they reopen? And secondly, if there are, say, caps on the number of patrons, what do you say to businesses concerned that it'll make them unviable?
Well, we are just at the beginning stages of a very complex and lengthy process to answer that question. What will be the circumstances surrounding the reopening of dine-in restaurants in Toronto? And there's a whole variety of different options you could look at, all of which will be guided by considerations of public health. And that will include whether you could open the entire restaurant, whether you could open parts of it, whether you have new requirements that exist with respect to the sanitizing and disinfection of those restaurants, and a whole host of other things. And so we can't answer the question as yet, but one of the things that we'll have to take into account, secondary to public health, it has to be number one. Public health is, you know, what is the impact of any decision you make, any option you choose on the viability of those businesses? Because we have worked hard to help them survive, as has the Government of Canada, but you know, we have to make sure public health stays number one. So those are questions yet to be answered, part of the immense complexity of reopening a city that has been shut down largely in all respects, and that's an industry we want to come back strong, and we'll be taking decisions to try and make that happen, but always with public health being number one.
Okay. That's it for me. Thank you.
Okay, thank you, Albert. We'll now go to Jeff Gray from the Globe and Mail. Jeff?
Hi, everybody. I just wanted to follow up on the plans for the homeless. And I think Marianne might be on the line, possibly to take the question. Have plans changed with regard to this 400-bed recovery center? Is there a different plan in the works? We had heard maybe a week ago or more now that there was going to be this large facility that would be a recovery center. Is there a different plan now in the works, or is that still coming?
Go ahead, Marianne.
Hi, Jeff. Thank you for the question. Yes, we are continuing to work with our health partners. I think what we have learned over the last few weeks at the interim site that we're currently running is that we have a model that works really well. It works really well for the clients who are recovering from COVID-19. It provides them with an environment of dignity and privacy in which to recover from COVID-19. And it works well for both the shelter support and staff housing, shelter support and housing staff that are there, as well as our health partners. So what we're going to do going forward, as we need more capacity, is we're going to look to replicate the model that is currently working. And so we'll be looking for another site that will provide us additional capacity, and we'll definitely be having those discussions with the province because this is a significant support to the healthcare system, and we'll be looking for some partnership on that.
And maybe you could just to follow up on that. By model, you mean a hotel with rooms instead of a large facility? Is that what the change that you've enacted here?
Yes, initially there was some thought that sort of a more open congregate setting would be appropriate. I think what we've learned through the working model that we have going now is that it's actually more beneficial for the clients and for the staff to provide the type of accommodation that we've already been able to do. And it's a working model, and when you have something that works, you're better just to build on that than to change course.
Okay, thank you. We'll go to Jennifer Pagliaro now from the Toronto Star. Jennifer?
There, I'm wondering if Dr. de Villa could give us an update on the situation at Seven Oaks. I understand there's been additional deaths, and I'm hoping that you can confirm.
So thanks, Jennifer. I think Paul Raftis may in fact be on the line and has the most up-to-date information.
Go ahead, Paul.
I am. Thank you very much. So in terms of Seven Oaks, we do have 108 positive residents at that site. As well as we have unfortunately had 32 deaths there. And our deepest condolences go out to the family and friends of those who have passed away. In terms of what is happening there, we're working very closely with Toronto Public Health and the ministry to ensure that we have implemented full recommendations and guidelines. And of course, the team is working around the clock to do everything to stop the spread. We have an outbreak management team that is ensuring physical distancing, isolation of residents to the best of our ability. Of course, we have the use of personal protective equipment 24 hours a day there, active screening for all staff coming in on shift, and that includes temperature checks twice a day. And of course, we have enhanced cleaning and disinfection and IPAC procedures. Yesterday we did welcome, the day before yesterday, we did welcome an IPAC specialist team from Scarborough Health Network. They came in and did a full review with us, and that was a very positive review. In terms of staffing, we have ensured that we have reassigned divisional staff and management staff. We're maximizing our frontline staff availability, overtime. We've hired some nursing students to work as PSWs. And of course, as the mayor had mentioned, we have redeployed staff from other city divisions to support the home.
And I wanted to ask Rick on another topic. I wonder why fare inspectors are not included in the temporary layoffs.
Just a moment. We'll get Rick to answer that question for you.
Sure, thank you. So, our fare inspectors are still out riding the system and in our stations. Their primary role is to play customer service as well as security right now, so they're not included.
Okay, thank you, Rick. We'll now go to Matt Bingley from Global News. Matt?
Hi, Dr. de Villa. The union representing transit workers who are being laid off are saying that the restrictions now that are in place by having fewer buses, fewer routes open are going to create more opportunities for crowded buses and less opportunities for physical distancing. And I'm just wondering what concerns you have with regards to this.
Well, thanks, Matt, for the question. I haven't had an opportunity to really discuss in great detail around what the bus routes are going to be on a go-forward basis, but suffice it to say that I know we've had conversations with our colleagues at the Toronto Transit Commission and that they're well aware of the physical distancing measures that are required in order to control virus spread in our city. And I trust that they will be managing their operations in a fashion that's consistent to the greatest extent possible with what our public health goals are in respect of controlling COVID-19.
And just to follow up with Marianne Bedard, just following up on Jeff's questions, that 400-bed recovery location, am I to understand that that is completely done with now? Previously you had said that you had located a site, so is work ceasing on that site, or is that still a future possibility of having that open at some point?
So the plan for recovery for more than 400 clients is very much still in the works. As I said, we continue to work on a second site. The difference is that we're looking at a site that provides a similar program model than we're already using. We will continue to have the alternate space available to us should we need it for additional physical distancing or other types of program support.
Okay, thank you. We'll now go to Mark McAllister from City News. Mark?
Mayor Tory, if you would, very briefly, you had mentioned in your remarks that City Council has our back, but you did mention that you're meeting at the end of the month. Could you elaborate, and how exactly are you going to do that?
Well, the emergency management legislation requires that if I exercise the powers given to me on behalf of the council during an emergency period, that within 30 days of that exercise of power, there is required to be a meeting of City Council. Consistent with the physical spacing requirements that we have in place for everybody else, the City Council will be meeting virtually using a platform that is secure and appropriate for us to do. And we have been putting together an agenda which will be fairly straightforward. It involves, in large part, a report by me to the City Council on the exercise of the emergency authority granted to me by this declaration and such other matters as we bring before the Council for their consideration. It will be a special meeting in that respect, in that it won't have the usual kinds of reports from different parts of the city government machinery.
So what exactly will, aside from a report from yourself, will be debated among the councillors, and are you expecting full council to take part in this virtually, or is it a matter of quorum?
No, I can't. Well, I mean, people will come as they decide to come, but I'm quite sure every member of council will be there, given the importance, obviously, of having a meeting during the time of an emergency, and to discuss in particular the accountability that I have as mayor for the exercise of authority during that emergency, a request that will be made to extend the period of the emergency declaration for an additional period of time, as well as other reports that will come from parts of the city machinery under the guidance of the chief and the operations center, as well as the city manager. And so those reports will be given as well. It's as much as anything else a very important public information dissemination and accountability session, but also there will be some decisions about the emergency powers and so on that will be put in front of the council for their consideration.
Okay, thank you. We'll go to Scott Lightfoot now from CTV News. Scott?
Thanks, Brett. Question on long-term care, so probably Dr. Villa, maybe Paul. How many city-run long-term care facilities have zero cases of COVID-19, if any? And how do you think that testing all the residents will change the landscape in Toronto's long-term care facilities?
Okay, we'll ask Paul Raftis to answer that. Please, Paul.
Yep, thank you very much for the question. So in terms of zero COVID patients, if I'm just looking at the list here, I would say that we have 6 that have zero COVID patients. The homes that do have confirmed COVID patients are Seven Oaks, Kipling Acres, Lakeshore Lodge, and Castleview Witchwood Towers. In terms of the testing, I do believe that the numbers are going to continue to rise. We've seen a sharp rise in the numbers in the last week. Our team has been working with Toronto Public Health hand in hand since January on this. But in particular, in the last week, we've been working together also with Ontario Health on testing. We've completed 1,473 tests. And in the coming week, we plan to likely double that number of tests. So we will see those numbers rise. And we certainly hope in the homes where we don't have COVID patients that it remains that way. But we will see in the coming number of days.
And for the people on the panel, everybody made a point today of speaking about the fact this is sort of a 1-month anniversary as to when that state of emergency was declared. So, and you don't have to get too in depth here, but what, if anything, would you have done differently knowing now, or knowing then what you know now?
I think that, hindsight always being 20/20, you can look back on things like inventory management and just say that had you known what you knew, but would anybody necessarily have known that our consumption, for example, in 1 2-week period for the long-term care residences of surgical masks would have gone from 18,000 to 180,000? You wouldn't necessarily have known that because that was preceded by a couple of orders that were given, I think, at the provincial level to change the protocol for those kinds of things, and it was accompanied by an increasing severity of the outbreak in long-term care homes. So that I think there are things like that that we will learn how better to plan for from this, because I think that's always the case with these incidents. As well as you plan from the last one, there are going to be aspects of this one that are different, that teach you lessons and that prepare you for what you hope isn't the next one, but you always know something's coming. So I think there are things like that that we will spend a lot of time on after we plan the successful exit from this pandemic, which is, of course, an important priority of ours, and get it over with, most importantly, so that we can get on with reopening and restarting the economy.
Okay, thank you. Final question goes to Mark Douglas from 680 News. Mark?
Thanks, Brad. First question then to Mayor Tory, and it's about the 1,200 layoff notices for the TTC. Excuse me, I've already spoken today with Mr. Leary about this, and I've spoken with the union local president, and he's calling this a real punch-in-the-gut situation here. So I'd like to hear from you, Mr. Mayor. Was there no alternative to these layoffs? Would it not have been better to perhaps reduce the service levels even slightly and run the subways and buses just a little less frequently as a way to avoid layoffs?
Well, let's understand exactly what's going on here. A letter was submitted to the union today as required by the collective agreement. And what it does indicate that there could be up to 1,000 people affected if a layoff was necessary. But a layoff isn't necessarily the answer here, and it now commences a period of 30 days during which the management of the TTC will sit with the union. And if I can take the precedent of what we achieved as a city with Local 79 of CUPE and with Local 416 of CUPE, whereby we found ways in which we could have limited numbers of people go on to what's called an emergency leave as opposed to being laid off, then that is the kind of thing that we hope the union will be quite willing to discuss with us in light of the fact that the TTC, unfortunately, at this stage is hemorrhaging $20 million a week. And so we have to do something about that while trying to maintain, as we will do, service levels, especially in the areas that are most heavily traveled during this time. So I'm an optimist about this and think if everybody comes to the table with a reasonable attitude and a willingness to talk, that we can, as proven by the city and its unions, work together to find a way in which we can have many fewer people affected than what you suggested. And it is the beginning of a process, not the end of one. Nobody has been laid off as of this moment. I will also say that I'm proud of the fact that this council, led by this mayor, namely myself, have put a record investment every year into the Toronto Transit Commission. We will continue with that progress going forward, but right now we have a very serious financial situation that we have to address in the interests of being able to maintain services of all kinds, including transit, for people as we emerge from this pandemic, and that is the responsible thing for us to do, to examine these kinds of things, to do it with as little pain for people as possible, including the people who work with us. But now there's a period of negotiation which will determine whether we can do it in a way that is better for everybody concerned, or whether we have to resort to what the collective bargaining agreement provides for in terms of layoffs.
Thank you. And the second question then also to you, Mr. Tory. As you mentioned, it's been 1 month since declaring the state of emergency. What are you expecting to see in the next month to come? And I'm wondering specifically about, reopening some sectors of the economy and when we might hope to see the state of emergency itself lifted.
Well, the most frequently asked question, of course, is that one that I get asked by the media, by people that I am in correspondence with by email and otherwise, and I have to answer to them that I don't know that date. But I do also go on to say, and I say it in a way that is as collegial as I possibly can, a large number of the people that will determine the date when it comes are the 3 million people who live in the city of Toronto, because by adhering, as many of them, most of them are doing, to the self-distancing and to the self-isolation and to the staying at home and to the shopping once a week guidelines and requirements set out by public health, they will expedite that when that day comes. Our job in the meantime is to continue to do the good work all three of us have described today, supporting people who are vulnerable, keeping the city going, keeping essential and critical services provided for people, as we have done, but also at the same time to do the incredibly complex and detailed planning we have to do so that when we begin reopening and restarting the city, that we will do so in a way that is competent, that is organized, and that places public health number one. I can tell you that we are in close consultation with the province of Ontario about this because they too are doing the same kind of planning. I talked to the Premier the night before last about this and some of the measures that he's considering, and we will work in collaboration with them to make sure that we have a plan in place that can do this in a way that is effective and that is organized, but also is sensitive to the paramount needs of public health and making sure this virus goes away and stays away.
Thank you, Mayor Tory, and thank you all for tuning in. We will talk to you again tomorrow.